I think that we have become more of a name because of the Neuro Emotional Technique work. People want to try something different. There is more awareness with especially mental health and emotional trauma. People are recognizing that we don't need to hold on to these things, and they do create disease and illness in our body. Our practice is identifying those things and helping people process, and I think that's a beautiful thing.
Welcome to The Beginner's Guide to the Third Eye, the podcast that delves into the profound realms of spiritual experiences, exploring the dedicated practitioners and various modalities that guide us on our transformative path. Together, we will explore the mystical, the magical, the enlightened, and the sacred. In each episode, we pair seasoned practitioners, spiritual experiences, or healing modalities, and a willing participant to share their experience in working together. We will explore the unique insights, stories, and wisdom gained from their own profound journeys, unveiling the extraordinary narratives that shape spiritual seekers and practitioners alike. My name is Krista Rauschenberg, and my work as a healer has emerged from hundreds of hours of certified training, spiritual initiations, direct experience, and deep personal work. I have been employed in the healing arts as a postpartum doula, an advanced Akashic reader, an Akashic breathwork practitioner, and a writer. Facilitating and educating people through their personal, spiritual, and healing journeys is my greatest source of happiness.
And I'm Elle Larson. I use sound and space to help balance internal and external environments. I've practiced holistic healing modalities for over 20 years, and my work includes Tibetan bowl sound healing, feng shui, Reiki, and shamanism.
Welcome once again to the Beginner's Guide to the Third Eye, where we demystify the mystical. Today we're going to learn about Neuro Emotional Technique, which is NET. It is a mind-body approach to health and wellness that combines elements of traditional Chinese medicine, chiropractic care, and applied kinesiology. NET is based on the premise that unresolved emotional issues can contribute to physical symptoms and illness. The technique involves identifying and releasing neuro-emotional complexes, or NECs. They are believed to be stored in the body as a result of past trauma. Practitioners use muscle testing or applied kinesiology to identify these emotional blockages and then employ various methods to help the patient release them. These methods may include specific chiropractic adjustments, affirmations, or forms of psychological intervention. The goal of NET is to address the underlying emotional causes of physical symptoms or health issues, thereby promoting healing and overall well-being. Let's welcome our guest for this episode, where we discover NET, the Neuro Emotional Technique. Dr. Jerry Lee is a dual licensed doctor of chiropractic and acupuncture. He specializes in a variety of kinesiology techniques based on the triad of health, which is physical, nutritional, and emotional stressors that may be affecting the body. He uses natural and holistic hands-on methods to examine how the body is functioning as a whole in order to address the root causes of any symptoms. He has dedicated thousands of hours in postgraduate seminars and has earned many certifications to provide optimal care for his patients. He believes that the body is self-regulating and self-healing, but sometimes needs a facilitator to help guide the body towards achieving the optimal state of well-being and recovery. And our willing participant is Valerie. She's a writer, mother, mindfulness teacher, and podcaster, and has generously agreed to share her experience with us. We developed this podcast to showcase energy workers and demystify what they do, how they do it, and why they do it. So I would love to start at the beginning and get a bit of a background with you, Dr. Jerry. I know that before deciding on your chosen profession, you shadowed a lot of different doctors and such. Can you tell us a bit about your journey and how you landed on the work that you do now?
I was introduced to chiropractic in high school because I played on the high school basketball team, and our team doctor was a chiropractor. And I happened to get to know him a little bit better because we had a career day where he was also a speaker and I was one of his hosts. And I built a relationship with him. I was introduced to Chinese medicine and acupuncture, more so being raised in a Taiwanese household. My parents often used Chinese medicine and the different philosophies. My mom had a fibroid and she used Chinese herbs, went to an acupuncturist, and I remember growing up, she would cook Chinese herbs and boil them and drink this nasty smelling, tasting herbs, but it worked. It helped shrink thyroid. And my father, he had a stroke in his mid-40s, and one of the things that helped him out was going to the acupuncturist. They did a lot of acupuncture on his face. That helped a lot. So that was my introduction to a more vitalistic, more holistic approach to medicine. And when I went to college, I studied kinesiology, the study of human movement, going on the trail of already knowing that I wanted to go to chiropractic school or physical therapy school. When I started looking into the similarities of how both have a vitalistic approach or holistic approach, I really loved the combination of natural means of getting the body back to health and the overlap between the nervous system and Chinese acupuncture meridian channels, using more holistic methods to treat the body. And
Did you have to cross any belief barriers?
I think I didn't realize until I got into chiropractic. And then
Interesting.
there's always this, you're trying to prove the chiropractic, and you're trying to play up to the Western medicine side of health. The school that I went to tried to make it a little bit more evidence-based.
Yeah.
Old school chiropractic, where it came from, was more of a metaphysical kind of philosophy. And I like that about it, though. It crossed with the acupuncture philosophy as well. I love the fact that there is the evidence now that is proving how effective it can be. But I also like the fact that it's a metaphysical approach.
So you were always open to that. It didn't.
Yeah, definitely. Yeah. In chiropractic, there's so many different modalities that you can do. There's a technique called Thompson, using drop table techniques. There's an activator technique. There's a specific chiropractic manipulation technique called Gonstead technique. There's more gentler techniques called sacro-occipital technique or cranial work that you can do. I happened to listen to this guest speaker because they would have these lunch and learn lessons. My first was kinesiology. I think it was my second trimester of chiropractic school. And this guy talked about looking at the body as a whole, and he showed something called the triad of health, which is the bottom is your structure, your physical body, and the other two sides of the triangle were your chemical and your emotion. So looking at that whole triad of health, that made me say, okay, if I go down this route, this is really what's going to make me a true doctor, not just a chiropractor that's going to do whack and crack and stuff like that. Nothing wrong about that. It's just I wanted more. I wanted to do more, going into diet, nutrition, going into the mental health aspect of emotions and how they affect the physiology of the body.
Growing up as an athlete really puts you in your body and has you appreciate the physical form and what it can do. And then growing up in the household that you grew up, it seems like the perfect recipe for you to step into this.
Yeah.
How would you describe what you do? I know that you incorporate a lot of different modalities, and it's not just NET, which is something that we are going to focus on today. But am I right in thinking that NET is the main component to what you do?
Absolutely, yeah. So NET is Neuro Emotional Technique. It's a muscle testing technique founded by Dr. Deb and Scott Walker in the 1980s. And the foundation of that actually came from applied kinesiology. Applied kinesiology was founded by Dr. George Goodhart in the 19th century. A lot of people don't know, but Dr. Goodhart was the first chiropractor in the Olympics in 1980. He was well ahead of his time. Kinesiology is the study of human movement and how muscles connect to organs and how organs connect to the vertebral segments. So we really work from the inside out. So there is more of a physiological, biochemical, neurological basis to it. And there's a lot of different techniques, and some of them are more based off chemistry. Some of them are based off of energy. There's a technique that I do called total body modification. The founder, Dr. Victor Frank, he was a chiropractor and a naturopath, and he was part of this group called the Dirty Dozen, where they were 12 doctors that formed this International College of Applied Kinesiology and a lot of the basics of applied kinesiology. But he thought that the muscle testing part took too long because he had to test all the individual muscles in the body. So he zoomed in onto the muscle testing and found that you can use the organ points as circuit breakers. So there's body reflex points. And so when you find a inhibition in the muscle test with one of the reflex points, then you can find if it's something structural. You can just optimize the nervous system by tapping on different energetic points on the body. So it became more of an energetic technique, looking at the body as a computer, and you're just optimizing the system. And so his son created a technique called evolutionary quantum healing technique. And his son is one of my mentors, Dr. Randy Frank. And he's based in Germany right now. His work is the vial work done with the energetic downloads. It's just a little bit more condensed, but definitely a little bit more of the energetic side of things.
I could imagine what your protocols look like at the very beginning to what they are now has changed so much.
Yeah,
How exciting to be in a field that you constantly keep learning and growing and changing.
yeah, definitely. And that led me to doing the neuro emotional technique because as I was playing around with all these different techniques and doing nutritional techniques and helping find what supplements a person needs based off of the biofeedback testing with muscle testing, the more emotional work that I did on the body, the less supplements and herbs that they needed. Doesn't mean that it didn't help and that they don't need it on a day to day, but at that moment in time, after you work on the emotions and help the body cleanse the emotional distress that they're holding on to, sometimes the supplements didn't test afterwards. That was what led me to do more of the NET. It kind of just happened. It happened to be one of the techniques that my mentors before me said, okay, take these techniques. And then the more I did the emotional work, I was like, oh, wow, the body is actually clearing itself with the things that it needed chemically.
It's amazing. It's amazing. Val, I'd love to hear a bit about your background and experiences. What kind of readings and healings have you had before?
Yeah, I've done various Reiki with different people and acupuncture in the past. I wasn't raised with any of those things being normalized. In fact, I was raised in a evangelical Christian household that was probably assumed that was the opposite of good, letting in darkness or something. I came to it as I got older. I left the church and started to get to know my body in a different way. I would say I was very dissociated for at least the first 27 years of my life.
What happened at 27 to change that?
I wasn't aware that I was dissociated, but I started to be more interested in energy work. And I'm trying to think of like why I was open to that all of a sudden, other than I just lived in LA.
And old LA.
And it was the osmosis or something. And then when I was 29, everything just cracked open. I got pregnant and a lot of trauma came up, but I didn't know that's what was happening. I thought I was going crazy. I thought I was losing my mind and just didn't feel like myself at all and had to start to get into my body to just care for my body and my baby. And so that's when I started the basic mindfulness practice of focusing on my breath and letting the feelings come up and come out. And then I started seeing a somatic therapist. And that's when everything got organized, where I was like, okay, I knew there was trauma in my childhood, but I thought that because it was the story that was told to me and sold to me, that I was okay. It wasn't that big of a deal. I somehow miraculously was already healed from it and forgiven everybody involved and all of that. So that was the way it was brushed under the rug. So I was surprised that it was coming up. I would say the dissociation ended as I was pregnant and getting more in touch with my body, but it was such a slow burn. And the early days of somatic therapy, with the direction of my therapist, I would go into my body and say, okay, show me anything you want to show me. And it would just be silent. Like I couldn't make connection for about a year. And I have such a good patient therapist who taught me to just keep showing up for my body. And it was really this connection to my stomach, which came up a lot in my session with Dr. Lee, that sort of cracked open the whole thing. So I was exploring the area in my stomach, and there was a softening and then a huge release. And then the series of huge releases for about a year after that. And that was when I started having a relationship with my body. I had a feedback loop where I was showing up for it and it was revealing everything that it holds to me, and it changed everything. So I would say somatic work and mindfulness of the body, embodiment in general, all of that has been my healing path, letting the body communicate its needs. And that's what I specifically loved about what Dr. Lee offers is it's just talking to the body. It's letting the body tell you everything it needs to know and having such respect for what it says. And we had the experience that you said, Dr. Lee, doing the biofeedback, I had a lot of supplements recommended. And then after we did the process, there was really only one.
I would give you an A++ for processing during the session. It was amazing. You could tell you'd done a lot of work because your body really revealed itself. And then you took such beautiful time with it and space with it to allow it. There was kind of a harmony that took place. Like you knew what it needed and what to do. That really struck me. The session was incredible. And Dr. Jerry, you are such a beautiful practitioner, and that you are bowing to the greatness of the body and going in with this beautiful curiosity and rhythm and timing and beautiful support as well. The session was extraordinary.
That must have been a really intense time for
Sure.
you, 27 to 29. That also corresponds with your Saturn return,
Yes.
which is interesting that all those really challenging life lessons were revisited and revealed to you before you entered the space of proper adulthood.
Yes.
So is that something that you've reflected
Absolutely.
on in the past?
Absolutely. It really was a true Saturn's return in every possible way. And it happened to correlate perfectly with becoming a mother. So it was like, it was going to happen. It was Saturn's return. And I really believe it was triggered the day I conceived my daughter. That was when this whole thing broke loose. And I didn't even know I had conceived her. And there was such the time is now. And it felt like her little soul was entering my body and shining the light to expose all the cockroaches and clear me out. And still she does this. She's 5 now, but to become the mother and the person I need to be for her. So yes, it was a huge turning point. It really was like one of those never the same again things. So
Thankfully, huh?
yes, thankfully. And I can see how it really set into motion so many different things too. Like I didn't really have a spiritual path at that point because I was still recovering from my very religious upbringing. I was not interested in anything spiritual. I wanted to just keep it simple, keep it material. And out of pure necessity, I had to go back into connecting with my spirituality and the divine and everything. And that's just one of the many gifts that difficult time gave me.
Beautiful. Dr. Jerry, for someone that has never experienced NET, how would you describe it? What would you consider it to be, or what is its purpose?
Mainly just using the muscle testing as a guide to identify where the body is holding on to unresolved stress patterns that are held in the organs. In Chinese medicine, organs have specific emotions that they hold. And so using the muscle testing, we're able to identify where the body's holding those stressed patterns and help the body release and just process. So my mentors always said that the emotions are like food. So you ingest, you go through an event, you digest, you break down what happened, and then you absorb the nutrients, like you learn the lesson. And once you're done, you excrete it out. But sometimes our body holds on to things and we don't let it go. And so with the NET process, we're just helping the body process it out and let it release.
Is there
But
any indication why we do that, why we hold on to things?
I think a lot of it is based off of the survival mechanisms that we hold. And thank you for the kind words earlier, but I wanted to give props to Valerie because she was the one that was doing all the work. And you can really tell that she was connected with her mind and body, and that she had done previous work that she could make those connections. And there are a lot of times where people are unfamiliar with this type of work, and you ask them certain questions and how do you connect these two different things, whether it's the emotions and experiences, and they have no clue because a lot of it is based off the subconscious. But with Valerie, it was so easy, and she was able to recognize and pinpoint. You could tell that she had been prepared and had done the work. I tell people that I'm just facilitating. I'm just telling you what I'm reading and what the body is telling me, and you make the connections and you do the processing. So it's just the facilitation.
You do it in such a grounded way, though.
That's
Thank
what
you.
I was going to say.
You need to take some credit there.
Yeah, I agree. I was going to say it is teamwork because especially
Yes.
when you're dealing with trauma, the body knows whether it's safe or not. And there is a unspoken energy that you transmit that lets people feel safe enough to open.
Thank you. Appreciate that.
Yeah.
I always say it starts with belief, and you're very believable. Belief allows trust, and I always feel very safe with you. And then that allows surrender. So you get lots of credit. So, Dr. Jerry, I thought we could do a bit of a breakdown of your sessions. They're just so unique. Maybe we could start with the downloads and balancing. I want to give an overview of what happens and what the body is able to recognize about the work that you do.
But yeah, in the beginning, I always use this biofeedback machine because I want to see what the computer comes up with. We have this tool called Zyto. It uses a galvanic skin response, which is what they use for lie detector tests. And so you just put your hand on it, and then there's surveys with your vertebral segments, your meridians, your organs, your neurotransmitters, emotions, what have you. And then I go into my own muscle testing techniques. And I just mix and mosh all these different techniques that I've learned throughout the years. But really, the first thing is just identifying what the stressors are that might be affecting the body. So I have different vial kits. They're just basically harmonized energy to certain frequencies. And so if a bacteria or a virus comes up or a parasite comes up, we can identify where that can be affecting the body. Sometimes with that, you're finding chemical solutions, whether it's an herbal solution or a multiglandular nutrient or something like that. So we identify what needs to be utilized to help eradicate those different stressors. But what I've found with the work that I do with my mentors is that we want to also clear the energy of it. So even though a parasite might show up or a bacteria might show up, it could be an emotional parasite or an emotional virus. And that's like my guide of how I have the person hold the vial in their hand, and then it inhibits a muscle. And then we find what nutrient it needs. And then we identify how we clear the energy of it in the body on an energetic level. So usually I will use NET or I use the flower essence to wipe away the energy of that pattern in the body. And the person can connect to certain people that might be pulling energy. So that could be an emotional parasite or something that is just latent in the body that is causing the body to be more deficient in something. And it could be like a virus or a bacteria or something like that. Using something called the triad of health, which is the structural aspect, that's the chiropractic part, the chemical aspect, which is finding the nutrition, and the emotional aspect. So it hit on all three fronts of that.
Practical question. Let's say I come in and I test that I have actual parasites. I would probably get some kind of herbal remedy for that. What's the counterpoint to that? Is there an energetic release that you do that would help or benefit releasing the physical or the actual parasites? What's the approach or technique?
Yeah, it could be related to energetic parasite or an emotional parasite that the body might be holding on to. Using NET as a tool or the flower essences. There's another technique called creative emotional wizardry where you're also pulling the frequency, the energies of those microbes. At the end, sometimes the person does need an herbal supplement to eradicate. Sometimes the body says, no, I don't need it. We already cleared it. I think that's a belief thing as well. If you believe that you can energetically pull it and eradicate it and wipe out the frequency of the body, then it can be done. But then there are also cases where you do need to get in there and use some type of herbal supplement or homeopathic supplement or something to help balance the body out.
So you actually can eradicate it with a frequency energy shift.
I definitely think that you can do that, yeah.
This is a technique called evolutionary quantum healing technique. These are different vials. Think of your body as a computer, and there's different frequencies that we download into the system because we want it to heal. Your baseline is within muscle test here, so you can hold it here. Okay. So it's nice and strong. And then I'm going to do a quick reset on your body's system. This is safe, let it relax. And then big breath in and out. Good. If I go here, I can test all these reflexes, just see if there's anything. Let's go to your pituitary. Let's go to your thyroid. Let's go to your thymus, heart, lung, so the left lung goes weak. So there's, I don't know what, but there's something going on there. It could be emotional, could be chemical, could be nervous system supply. Okay, but there's something there. Let's go to your liver, gallbladder, spleen, pancreas, so stomach, that's weak. Okay, I can go to your kidney, so the left kidney goes weak. Colon, small intestine, adrenals, bladder, uterus, ovary. Okay, so there's a couple things. Okay, so we can turn these on by different means. But what I'm going to do first is download the technique vial and then get your organs working and systems running together. Okay. I do this on every visit. So we've got to go here. So it'll go weak because the body doesn't recognize this. This is the save button, so it goes strong now. So we're just going to tap it into your system, okay? It's pretty interesting. Big breath in and out. Good. And some people feel stuff with this, so yes, nice and strong now. So that means it's downloaded in. Take it off your energetic field, put it back. And it's nice and strong. Open doors, therapy with ways of walk. Keep it on the body. That's fine. Good. So then that's one vial. So I do 3 vials in the first visit. Okay. This is a COVID vaccine vial because there's been some negative findings from that. So this energetically clears your field.
That's
Okay. Good. Yeah. So it goes weak. Okay. I'm going to optimize it. Breathe in and out. Good. Nice and strong. Sometimes we'll go back to some of these vials if it comes up, but these are the first 3 I'm interested in just doing on everybody. This is a flu-like vial. Good. And we were talking about this during November, December, January when there was a lot of flu going around.
Yeah.
So he was saying check this on everybody. But even though, you're doing okay, but sometimes you never know. Some people are asymptomatic, but they'll still have present something in their field.
Sure.
So you're good on this one, though.
Okay, that's
Okay,
great.
that's good. Good. Okay.
And what the first one was just more of a general.
It's a reset to get your organs talking together and turning on the system.
Wow, that was cool. I
Yeah.
really did feel
You
it.
feel that? Okay,
It's like
cool. That's awesome.
well-being.
That's good. That's awesome. So now, but watch, if I go back, so let's go to lung, right? So that was weak earlier. Stomach is better. The kidney is better. So we got this systems working together now. What it does is just clears the smoke out. Now I can go a little bit deeper.
Sure.
If we didn't do that, then I'd have to chase all these other ones. But I just wanted to turn them on first.
Yeah.
Okay.
Makes sense?
Totally.
Okay, so now that we got that out of the way, now I can go into my normal work. Everything I do is just asking the body. Most important thing we could do with the body today, structural, so you do need to get adjusted, chemical, emotional, electromagnetic, spiritual, environmental, mental, metaphysical. You have some metaphysical. EMF, radiation, pathology, infection, disease, hormones, neurotransmitters, chemtrails. So you have structure, chemical, emotional, and metaphysical. Okay, so there's a lot of categories there we gotta work on here. Even though your scan looked pretty good. It might just be 1 or 2 big things.
Yeah.
I'm gonna do my own version of the computer, like a basic scan. So I use 2 kits, the red and the blue box. And then I have you hold different vials in your hands. So this says all levels, all dimensions. So the biggest part of this is the diagnostic. So I'm gonna have you hold these 3 and have you do different hand positions because they are the muscle tests. For example, like this. If I were to test this muscle, that's your infraspinatus muscle, and by kinesiology, it relates to your immune system. So I'm going to stress your immune system, and you're going to check for microbes. Okay, so this is like bacteria, fungal, virals. I get candida, which is like yeast. I don't know if that, you've ever shown for that.
I have. Yeah,
Okay.
it was a while ago.
And I get parasites. Okay, so those are the only 2, not too bad. If I didn't have you hold the vials, or if I didn't have you do the arm, then it may not find, because the body's kind of sometimes difficult. It doesn't want to reveal things, so you just have to stress it a little bit. So now I'm going to go into your arm like this. This is the stomach muscle. So we're going to check for foods.
Yeah, I've been doing more rice since the gluten.
Okay. So maybe there's something there. Okay. So I have a lot of things in here: corn, caffeine, dairy, wheat, all these things. But you're okay.
Wow.
So really just the rice right now, maybe because you've been doing good on the other stuff.
Yeah, probably.
Okay. So again, at a moment in time, then we're going to go like this. This is a heart muscle. You're checking for heart rate. Good. Now you're going to go straight like this. This is for chemicals and pesticides. Good, actually. As much as the computer found those, I don't find these right now, which is good.
Okay.
You're going to cross the midline of your body. These are heavy metals. Get mercury.
Yeah, there you
Interesting.
go.
Yeah. It's pretty fascinating, right? Now,
Yeah.
it all aligns somehow,
Wow.
energetically.
Yeah.
Cadmium. So cadmium actually you will get in rice.
Oh.
Actually. Arsenic too. Cadmium you'll get in breads and cereals and stuff like that.
Yeah.
But sometimes in rice. The biggest in rice is arsenic that we'll find.
Wow.
Yeah, but you didn't find arsenic in here.
Okay, that's
So,
good.
so there's some heavy metals,
Yeah.
but we're gonna clear it, don't worry. Okay, don't cross here. So there's a couple things in this kit, and then I have one more basic kit I'm gonna scan just to go a little extra. Now put your arm back up like this, and you scan. So I don't get mercury on this one, or arsenic, which is good. Different vibrational energies, and even go straight like this. Herbicides, pesticides, glyphosate, industrial, environmental, good. Okay, so the only one on this scan is estrogen. Okay, so I can take these out. Those are the trickier ones we have to go deeper with.
Okay.
I'm curious, do you hear a frequency in your body when you're working with somebody?
No, I just listen to what the muscle test gives me. I can't really say that I have any specific gifts in that sense. I think my gift, what I've told from one of my mentors is more clairaudience, is I think listening to the body and what it tells me. but mainly through the muscle tests.
Are you familiar with the concept of resonant frequency?
Oh, yes, of course.
Is this what you're working with in that
Yes,
sense?
yes, absolutely. The vial work is also changing the frequency. So some of the vials that we have, especially the evolutionary quantum healing technique and the technique called biodynamic resonance, is using vials that are pre-programmed with different frequencies and downloading it into the body so that it can make shifts.
Val, back to you. Tell us about your experience within the session, starting with your expectations or reservations coming in, and then tell us overall the effect that the session had on you.
So originally, Dr. Lee came up in one of my readings with you, Krista, and it was one of those things where when somebody recommends something, often there is a really clear yes or no, or not right now, at least. And it felt like a really clear yes in my body. So I was excited to do it. And in between the time that you had recommended him to me and when I actually got to have my session, my friend went to see Dr. Lee and she had a huge release and it came out in the form of projectile vomiting after the session, which you said, Dr. Jerry, like has only happened a handful of times or
Yeah.
something.
Yeah, it's happened a handful of times for sure.
Yeah. But
One time in
she,
my office, actually.
oh man, this happened in her car on the way home. But it really was amazing. It's like the body will release in some way and will find a way to do it. But the way she tells that story, it's like a huge victory because she felt incredible afterwards. It was a good release, even though it surprised her how it happened. So that's the knowledge I was going into the session with.
brought a bucket.
Prepare to vomit.
Yeah. It really was like, should I spend the night in LA? I don't know if I should go home. But yeah, there is always nerves a little bit when you know you're going in. You're going to go in and you're going to release and find things. But at this point, in general, I can decipher the nerves of this isn't right or the nerves of I'm onto something here and there's going to be good work done. So it was that feeling going into it. But I had done muscle testing one other time when I was 2 months postpartum and was trying everything and got a tincture of some herbal concoction that helped. So I was somewhat familiar with the muscle testing, but the biofeedback was new. And then specifically like NET was a brand new concept. The main thing that I kind of honed in on why I wanted to go was that I could feel I was still carrying so much in my stomach. My stomach has been the holder of everything that's happened to me. And it is a slow release. It releases on its own time. The way that manifests is I'm so sensitive to foods of all types. And when I'm even a little bit nervous, I'm like, ill. I just feel really sick to my stomach, really tight. So I just knew there was more work to be done there. And sure enough, everything we found was in my stomach. It was being held in my stomach. So as the process went on, there was so much being released, and we can go into more detail about that. But it was like big, huge waves of releasing. And then afterwards, it really felt like there were knots all in my stomach that had just been untangled. It was clear and light in there. And then even the simple things of like foods didn't bother me anymore, like real practical effect of not feeling nearly as sensitive in my stomach and just feeling way lighter and clearer. It's so different now. I really can tell.
I was struck by the accuracy of what your body was able to reveal and the connectivity between Dr. Lee bringing up issues and different traumas that associated back to you, and the accuracy was incredible. Can you speak to that a bit?
Yeah, absolutely. It's an interesting process because using the muscle tests, you hone in on the specific ages. So what was happening around 5 and what the specific thing was. So the thing around 5 was about crying, that there was some crying being held on. And that I really associated with being raised in a household where throwing a fit or having meltdowns or big feelings was just not allowed. In hindsight, now, even as a parent, I can see that my parents just couldn't handle their own feelings. And then to have a child's big feelings, it was just too overwhelming for them. And that also has come up as a parent because I'll feel that way about my child's big feelings. And I'll know, okay, this isn't about her at all. This is about what I was taught and I'm actually just connecting that she's 5 now. That's really wild.
Wow.
So yeah, I think a lot of cries that I had suppressed, that the body was like, okay, I will keep these until we're safe to release them.
But I'm going to
And-
keep reminding you.
Yeah, exactly. And then you're allowed now. It's okay. You won't be in trouble. So that definitely, I could feel that releasing. And then one of the ways that has had a lasting effect is I feel way more present for my child's big feelings. Like I don't see them the same way. I'm just like, okay, yeah, I get it. You need to release now. So that was a gift, not just for me, but for her too.
You also have metaphysical.
Yeah.
So metaphysical is allowing other people's energy to invade into your field.
Ah, yes.
Does that make sense?
Yeah. Uh-huh. That sounds
Okay.
familiar.
Okay. The phrase that pays, and we can check these with affirmations, the phrase that pays for metaphysical is, I want you to say, I allow them in, no. Say that.
I allow them in. No.
So see how it goes weak?
Yeah.
It's because you're allowing them in.
Yeah.
Okay.
I don't
So,
believe
yeah,
it.
so after we clear it, it should be strong. Okay,
Okay.
so let's see what's in the metaphysical good for you, okay?
Okay.
So energetic implant. So that could be the teeth stuff.
Oh,
Or it should be something else, maybe, I don't know if there's any other implant in the body.
no.
They get an energetic. Get something called a scarlet letter. So there could be something that they've been like branded, or you feel branded on you from scarlet letter.
Yeah.
Okay, so just those three, not bad.
Oh.
Okay, so everything I do is I honor the body. We want to clear these one by one and harmonize your body so that it's not affecting you. So how do I know where to go? I use these two vials. I just go hold, it says all entry point and all priority. So I'm just going to hold them and see, do we start here? So it starts with the implant. So if I go here, nothing. If I go here, it goes weak. So your body wants to start there. So it is energetic implant. This comes from a technique called creative emotional wizardry, where the guy really is like a wizard. Like he doesn't even use the vials; he just can feel it and pull it out, and you feel stuff. I'm not there yet, so I do it my way. So I'm gonna have you hold this in your hand, and we're just gonna see how do we clear it. Okay, it goes weak, so that means it's on the field. We have something showing on the page. We're gonna ask how do we fix it, and I go straight to Neuro Emotional Technique. So you're gonna clear emotion. Okay. So two things in life cause stress. One is the concept of money, finance, career, job, all the material things in life. The second thing is love. Anyone you've ever loved, anyone's ever loved you. And actually that goes weak. So in the category of love, we have family. We have family that you came from.
So yeah,
So
all
there's-
of this is checking out.
Okay, so that makes sense. I do have a soul contract vial in the metaphysical, so it doesn't come up.
Oh, it doesn't.
But I
Interesting.
think this is also just because maybe just the implant is like something part of the trauma. Was it
Yeah.
more than once, or is
It was more than once over
Okay.
like a short period of
I see,
time.
okay.
And yeah, the scarlet letter thing makes perfect
Yes.
sense because it is like I am the person who holds the family together
Uh-huh.
by keeping these secrets, by
I see.
protecting this person.
Yes.
That's
Yeah,
what
no, that makes
came
sense.
to mind.
That makes sense.
Yeah.
Okay. So let's see if we have to clear that after this. So the emotion goes to your colon. Okay. So in the colon we have emotions such as grief, dogmatic position, crying, concept of you're crying. So your body's still holding on to some crying feeling in the colon that we have to help you release. So we always want to get to the root of why your body might be holding on, or why you feel like you might be holding on to the crying. I mean, was there crying in those moments? Or was it just crying after the fact? Like, what is the root of the crying?
Yeah, that's a great point. I'm a little surprised because I'm like, I feel like that's the one thing I have done is,
You have?
but I would believe that there's more. There hasn't been enough crying there's never been any crying from either of them. That's so interesting. Okay.
Yeah. Or is it you were crying for help even too? Maybe?
Yeah, crying for help, definitely.
Yeah.
Yes, for sure. I had, as I've gone through this 6 years of trauma therapy, I would have these really big releases where I would sob and shake and release a lot.
Okay, good.
And I did that at least once a week for over a year.
Okay.
So there's a lot of that.
Yeah. Yeah.
And yeah, there probably is still more because there wasn't until the last 6 years.
Right,
There was
right.
just not.
Yeah.
I just didn't, it was sold to me like not a big deal.
Yeah. So let's check. Let me check. Is it your crying? So it's just, I think it's just like in general, there's just a crying feeling. What do you think, if there was any last part that you felt you might need to process?
Yeah.
What would it be about?
Yeah.
Is it about the family togetherness? Is it about, you know?
Yeah, I think the thing that comes to mind actually, as you said that, is like it's this relationship with my mother. Like I want her to hold me and cry with me and to acknowledge that this was a big deal.
Yeah.
To like really be in her body and actually mourn it and grieve it. Because it's all blocked up.
Yes.
You know?
Yeah.
So yeah, and so what actually came to mind is almost like a mother holding a baby.
Yeah.
Like I want that kind of.
Okay, so you just want to be held in that.
Yeah.
Okay.
Yeah.
Can you think about that feeling and not? So you never had that moment with her.
Right.
Okay.
Yeah.
Can you think about that feeling and not from a conception of 5, age 5, 4, 5, 6, 5? I guess something age 5. I don't know if anything is happening, but is there anything that comes up at that time?
It's a really,
So kindergarten.
yeah.
And is it with mom? Is it with that? It's both actually. So there might have been already a feeling of this crying out to want to be held and want to be nurtured. And is that,
Yeah,
or
and there
not that?
definitely was like a not comfortable with my emotions, not just like a stop crying family.
I see. Okay.
So that
Okay.
makes sense.
So can you go to the feeling of having to hold that in and suppress it? Okay. So I want you to go to that 5-year-old self. I want you to release. Okay. So you hold your forehead. So this is the mind part. This is the body part. So you're going to combine the body. And this is your time to process. So go back to that 5-year-old. Think about that crying feeling. I'm just going to tap it. So anytime you put your hand on your forehead and on the body part, that's your turn to process. Just allow yourself to let the charge of the crying emotion kind of pass it by. It's big.
Yeah.
Let's have some tissues there if you need, okay?
Thank you.
Yeah, I'll put them right there if you need. Okay, so you know where to go to that one. So it's actually even before anything started?
Yeah.
Okay.
Yeah. Definitely.
Okay, makes sense.
Yeah. And it's what came up too is nearly this is such a rooted belief of my emotions are inconvenient or unacceptable.
Yes.
The grown-ups in my life can't handle them. I can't cry. I can't feel the fullness of my feelings. It will wound other people.
Got it. Okay, that's a core, yeah, for sure.
Yeah, definitely.
Okay, I'm probably going to give you a flower after this. We'll see what comes out to have the kid that I feel it's going to be perfect. But I want you to go back to that 5-year-old self. Think about the crying feelings, stop those emotions, stop the crying. Good. And then I want you to turn your head to the left. This is to see if there's any other emotion at that time. There's not. Good. Head back right into my right eye over here. So if it goes weak on any of those, then that means there's more emotions, but they're not at the 5-year-old self. That's good. Now, I want you to put these 2 fingers here at the bridge of the eye. This is the signal for homeopathic, so go ahead and do that.
While I'm holding
Yeah,
this.
while you're holding it. So if I go here, so it's strong. If I connect it here, so it goes weak. And if I go to the emotions, so it goes weak. So what I'm going to do now, because you let go of the emotion, we're going to restore the energy field of the body. So when we do them, we just give you the, because you cleared the emotion in your lung, large intestine. So that's the metal element. So we're going to go to the metal spray, which is good for these type of things. If I go here and it goes weak, that means you let go of the big one. We want to restore the field of the body. This is called ER911. It's like a rescue remedy. We could use this for any type of these things. But right now we want to support the body. So I'll give you a couple sprays underneath the tongue. Doesn't taste like much like water. 10, 12 sprays, and then I'm going to use some ER911. Yeah, you can swallow it up. Okay. Watch what happens if you put the 2 fingers there again. And see how it goes nice and strong now?
Yeah.
And these go nice and strong. Okay. So we just help support the need, yeah.
Yeah.
Okay.
Yeah.
After we do a clearing, I always do this: poisons, a toxins, and then a drain. So sometimes the poison and toxin will show, sometimes it doesn't. Just keep pushing until it goes strong. Good. Nice and strong, eyes closed. Poisons, toxins, drain, eyes open. Perfect. And then we're going to have 2-point. Any of the factors, any of the best way to fix. There is another best way to fix. I'm going to go to the flower essence. Shame hack. I have a feeling shame hack is, these are just to give you an idea. Okay, let's see what your body tests for, okay? So it goes right to I am safe and I'm lovable. So say that, I am safe.
I am safe.
So there's a part of your body that doesn't feel it.
Yeah.
And you go, I am lovable.
I am lovable.
So go back to, let's give you a couple drops of this. This tastes like a little shot of brandy, which is nice.
Okay.
But this is the essence underneath the tank. So say I'm safe.
I am safe.
So it goes nice and strong. So that was the only thing for that. So we can take this out. You cleared it. Good. So an energetic implant could be some type of energy or entity could have implanted those type of feelings, like you're not feeling safe, you're not feeling lovable or something like
Yeah.
that. So then, yeah, you can just pull it out, or we do it this way. Okay? But let's go back to, I allow them in, no.
I allow them in. No.
So there's more. Okay, we haven't fully cleared it yet. Okay, so let's
I would
go
be
back.
suspicious.
Yeah.
It's been a few weeks since the session. Have the food sensitivities and that sense of calm and space and release, has that been maintained? Is that a constant now?
Yes, absolutely. It's been really interesting. The most common way that it comes out is when somebody checks in with me. They're like, how are you doing? How are you? And I'm like, oh yeah, I'm just totally fine.
You must have really been ready for it then, for your
Yeah.
body to hold those changes. I'm a sound practitioner, and during sessions, I'll feel a space start to open up and then move on to something else and then go back to that space and it's closed back up again. And it's because they're not ready for that to stay open continuously.
Yeah, I think you're right. It is a season in my life where, specifically related to my childhood trauma, which was a sexual abuse. And I've been the secret keeper of that in order to protect the abuser. And then I recently just told my brother, which was the big sort of act to be like, okay, I'm not keeping this secret anymore. And so I am in a real season of letting go, just letting go of the things that I should have never been asked to carry. So yeah, I can feel my body is in an open hand phase right now.
That's an immense amount of courage, no matter what age.
Yeah, thank
Yeah.
you. Thank you. And
Beautiful.
You.
it's interesting because it's come up in a lot of different healing sessions and with a lot of therapists over the last 6 years. And the first time it came up, I had a huge trauma reaction, like, okay, let's just leave this for now. And then it's been a series of really doing the work within myself to feel fortified. And then it came up in my last session with Krista in relationship to my creativity. So it wasn't even the session about that. It was like, I am blocked in my creativity. And the guides said, yeah, because you're carrying this secret. And then as soon as it got brought up, I knew it was time and I was ready. So there's something to be said about really not rushing the body's process and letting that happen when you're ready.
Not just the body, it's the body, mind, spirits, it's all of it. So
Right.
we have to let everything work together. It's harmony, it's balance.
Yeah, that's right. Absolutely. And the whole process, including my session with Dr. Lee, felt like that thick, surrounded in love. And that's the difference for me. That's when I've been able to tell it's okay, maybe this is right for another time, but it's not right for now. And then when things are right, I feel totally, even if I'm scared, I feel like a clear, thick bubble of love around it, which was definitely present in my session with you, Dr. Jerry. So
That's awesome. Yeah, I would say that the body truly is like a onion, and there's so many layers upon layers. But Valerie was really just ready for it. And sometimes people come in with the intention of working on certain things, but maybe the body's not ready to release. But in Valerie's case, it was just like she knew right away. So it was pretty amazing to see.
Dr. Jerry, you don't have any personal information prior to a session. You rely on everything to come through in your techniques as the body speaks to you.
Yeah.
And one of the things that Valerie tested for was the scarlet letter in relationship to sexual abuse. Do you remember that specifically? And can you talk about what that scarlet letter represents? And if you remember how it showed up in the session?
Yeah, that actually comes from a technique called creative emotional wizardry from Dr. Randall Roberts. The way that he does things is a little bit different than the way I do things, but just to identify that her body was holding on to some energetic pattern of being branded with the scarlet letter is what came up.
Wow.
We used a vial to open up the body with that, and then we cleared it with emotional technique using NET, but just helping her identify that there is this sense of like brandedness energetically, metaphysically in her body. So then helping her release it. There's just so many different items that we have with the vials. It could be emotions, it could be chemical things like pollution or pollens or theobromine from caffeine or something like that. So I use those vials to open up the body, and then I have a list of things from one of my mentors, Dr. Timothy Francis, asking the body, how does the body want to fix this and address this and harmonize it so that it's not invading the body anymore or just having that energetic imprint on it.
What are some of those options for the body to release?
But yeah, so NET is one, evolutionary quantum healing technique, the vial work, flower essences, homeopathics. It could be just even just an adjustment. So it's really just all the techniques that I've learned throughout my years of training with muscle testing and kinesiology.
You at one point had her release an emotion, and you had her put a hand on her head and I think a hand on her heart to connect to the body. Can you talk a little bit about that process?
Yeah, that usually comes from the Neuro Emotional Technique. So the hand on the forehead, there are 2 acupuncture points that relate to the stomach meridian on the forehead. And when people are stressed, they put their hand on their forehead and just take deep breaths and sigh and release. So what they found is we're just connecting the mind and body with where the person might be holding the stress response and the organs. So if someone's holding stress in the stomach, they would hold the stomach and then the other hand on the forehead, and you're connecting the mind and body and helping the person just breathe and release and go back to the physiology of the trauma or the feeling, because they do say you have to feel it to heal it. Or if there's anger in the liver, you hold on to the liver point and then the hand on the forehead and think about the feeling of the anger and get to the root cause, like the why or because. Does it make you angry? Maybe because I don't feel loved, or because I feel alone, or because I feel inadequate, or whatever it is. And we get to that time and place where the person may have originally felt that emotion. And that's where we can use the muscle testing to guide us to see, is it from conception to 10 or age 5, 6, 7, whatever it is. And then we just have them process that emotion, that original feeling.
Got it. And then there was a drain.
Oh, yeah. So the draining comes from a technique called the total body modification. So usually after an emotional clearing, you want to just get rid of any energetic or emotional debris that the body's holding on to. There's poisons, toxins, drain point that we just help release the negative energy from it.
Amazing. And then this is going to sound like a silly question, but why is it important to release these emotions? What harm are they doing?
I think it just stuns the growth of the person and the body and the mind, body, spirit. And it becomes a disease in the body as we hold on to these things. It goes back to Louise Hay's work with cancers and autoimmunities and cysts and fibroids and all these different type of conditions. There's always going to be some energetic, emotional pattern or root. So fixing the chemistry is very important. Looking at the labs and doing the muscle testing with the biochemistry is very important, but also what also about the emotional side or the spiritual side of things, because we've heard of people that have certain beliefs and that might be interrupting or clogging some type of pattern into the organs that might be causing the disease. I think there's always a balance of doing both and balancing the body that way.
You hear of people that have cancer and have cancer removed. It comes back because they didn't change any of the qualities.
Yeah.
The emotions are like a stagnation, if you will.
Yeah.
Does that make sense? It doesn't allow flow and life force and
Yeah.
movement, expansion, all of that. Yeah.
Life force, prana, whatever you want to call it, like just that life force. Yeah, absolutely.
And we have a physical response to our emotions, right? You can help to release chronic pain by releasing emotions in people.
Yeah, we have patients with huge thyroid nodules, and we do all the chemistry. We do as much energetic work that we can do, but until ultimately that person uses their voice and speaks to that throat chakra, and then it goes down. It's like pretty amazing stuff, just the body is capable of. So I think it's looking at the body in multiple dimensions and not just looking at it as one linear type of constitution. I think it's very important.
And you can change the chemistry, as you mentioned, but if you put the person back in the same dynamic, maybe it's relational or a family dynamic or marriage in the soil that they're growing in.
Yes.
When Val was able to let go of an emotion, you did something to restore the energy field. I think you gave her a metal spray because that's what she tested for. But what is restoring the energy field? Tell us about that.
So that comes with the Neuro Emotional Technique. Anytime you clear, let's say you're clearing something in the lung or large intestine. In Chinese medicine, the lung, large intestine are the yin and yang organs of the metal element. And
Mhm.
so specific homeopathic remedies get rid of the toxins energetically, homeopathically in those organs. So once you let go of an emotion, then we try to support the organs just through the homeopathic sprays.
What have you noticed in terms of the scope of NET? What are some of the things you've seen in your clients that have completely surprised you? For instance, has someone ever thrown up in your office?
Yes, absolutely. That has happened on my minds there.
Nice.
But no, it's an amazing growing field of practitioners. It started with chiropractors, and they added Chinese medicine philosophy, acupuncture philosophy. But it's so amazing just to see when I go to these seminars now, because there are medical doctors that are doing research at Thomas Jefferson University showing changes on functional MRIs through just sessions of NET. There are Psych Ds and family therapists and social workers, so many different practitioners that are a part of this neuro emotional technique family. And Dr. Walker's, the way that he's approaching it, he wants to avoid it becoming just energetic, but backing it up with the research and the scientific data for it. So it's pretty amazing.
That makes me so happy when these things get the respect that they deserve, and all of this to become more mainstream so that we can all live a very different life.
Yeah.
That's exciting. I'm always amazed at your accuracy or your ability to run these tests. How do these sessions feel for you? What are you experiencing as you perform these tests?
I really just go in as a neutral practitioner and allow the body to reveal itself to me. No expectations.
That might be difficult, right? Because that in itself is huge. Do you ever get nervous? Do you ever have to negotiate that, or is it just a given now? Do you just surrender and get in there?
I think that's the biggest thing. Having the energy and the intention is what I've been taught. So my intention is always just to allow the body to reveal itself, be space for the client, do the best that I can to help the patient. And having that mentality helps me stay a little bit more grounded and understanding not necessarily doing all the healing. It's the body and the person that's doing the healing. I'm just doing the facilitation of it and helping them find and discover certain things that might not have been in their consciousness.
So it's a partnership and you're discovering the client. That must be exciting
Yeah.
and interesting. Yeah. So Val, back to you. The feeling of disgust was released from your body in relationship to a childhood trauma. You mentioned that it was a deep release and it just kept coming and coming. I'd love to get an understanding of what that felt like, the sensation of that, if you can remember.
Yeah, that was definitely the one that surprised me, I think, the most. And it ended up being the biggest release. And the word disgust hadn't come up in terms of thinking of this trauma that happened to me. I've been trying to access like anger specifically around it. And I could, but it was like clunky. And once I really honed into this feeling of disgust, I realized the anger was folded into that and the sadness, like so much. And it was such a pinpoint accuracy. We're like, disgust, whoa. So yeah, that was where we had the vial and I held it to my stomach and I held my forehead. And Dr. Jerry just gave me the space to really go into the feeling of disgust. And the experience was, the way that I've actually described it to my husband afterwards is, it was the closest thing to labor that I had experienced, where it wasn't painful like labor, but it was like when you go through labor and your body is contracting, one of the main feelings is like, whoa, this is so big. This is so big and powerful. And that was the feeling. So even though it wasn't physically painful, it was like the floodgates opened and I just kept wanting to go, wow, wow. Like I couldn't believe how big it was. And then we even talked about it afterwards. It would come in these big waves where I was breathing and I wasn't consciously making the decision to breathe any specific way. My body was just doing it. So if I remember it correctly, like the first few minutes, I was like breathing like hard through my nose. Like it was like a real, like sort of activated, like warrior breath or something. And then I started to have slower, deeper exhales through my mouth where it was like labor breathing. That's the best example of it. And then it would start to slow down. And this is what we talked about afterwards. We'd both think it was done. And then it would come again in a bigger wave. And okay, there's a little bit more to be released. But the body was doing its wise action of coming in waves and having me get a minute of recalibration and then coming back. So it was big. It was a really big release. And like I said, that word disgust just was a word that my body knew that I did not know. I did not know. Yeah.
It is the accuracy. It matters so much. Even on a frequency level, the frequency of disgust was something that really allowed you access to what the body was holding.
Yeah.
Yeah, that just happens to be one
Matter.
of the emotions or words in the stomach chart, in the stomach emotions for neuroemotional technique. And so you might have worked on the anger in the previous sessions that you've done, but when we said disgust, your arm went down. And so that was the frequency that like you were holding on to.
Yeah. Yeah, that's right. And I think that's why the anger felt incomplete. It was like an aspect of the anger that hadn't been focused on in any way.
Okay, so let's go to the energetic block. Let's do the scarlet letter. In the scarlet letter. What he would do normally is he would find it and feel it and then just erase it out of your field and send it to the light. But that could be all in the stomach stuff too.
Yeah.
So I'm going to do it my way,
Okay, great.
which is usually more the emotional way. But let's see which one. I get the R.
Yeah.
But
That makes sense.
yeah. Okay, let's do it a different way here. I want you to think about oversympathetic, low self-esteem, just disgust. So the emotion is disgust. Okay.
That makes sense.
Okay. Can you get the feeling of it? And think about the why or because, right? The root. Conservation that you initially got this from the type of disgust. Conception of 10. Conception of 10. 10 to 20. 10 to 15. Age 10, 9, 10, 11, 10. So I get something at age 10.
Well, it's very possible it was age 10. Like the age is blurry. Yeah. Yeah, definitely. It could be, or that could have been what had happened at younger, and then age 10 is as I'm
You're conscious more
conscious
Aware of-
of,
yeah.
of getting disillusioned with
Okay.
this person.
Can you get the feeling of that?
Yeah.
I want you to get to the feeling of the disgust. I want you to really feel it in your body. Okay, the physiology. I want you to bring it out the moment you realize that it was happened. That it happened. Okay, so you're gonna go here and on your forehead. Think about that feeling. I'm gonna tap on your back. I actually still might do the erase on the body too. Think about this as it relates to you today. Big breath in. Yeah. Big breath in. Yeah. Big breath in. Disgust.
Oh, yeah.
Disgust.
Wow.
Yeah, that's big.
Really
It
big.
just happens to be in your stomach.
Yeah.
Makes sense.
Wow. And my stomach was like,
Yeah.
it was almost like labor. I just kept being, wow, that was so big.
No, I can feel you here. I'm feeling. So that's good. It's because you said you have to feel it to heal it. So we have to get into that. So that's good.
Yeah, that's
big.
wild. It was so bottomless.
Yeah.
Wow, this
Yeah, totally.
keeps coming up.
Yeah.
Ooh.
But that makes sense because it's in your stomach. Disgust. So that's,
Totally. Yeah, and when I read that before,
Yeah.
I was like, oh, obvious.
Yeah. So you must be just still holding a little bit of that. Hopefully this is fully letting you release and feel
Yeah.
liberated by it.
Yeah, it's such an interesting distinction too from anger. Like I would
Yes.
say,
Yes.
I always was like, I have such a hard time accessing the anger,
Uh-huh.
but that was it. It was like, oh, because it's disgust.
Disgust. Yeah. Yeah.
It's a different
Yes.
thing.
Okay. Good.
Oh, yeah. Whoa.
Good. No, I'm good. I'm glad you let that release.
Another interesting thing that came through was that you did a psychogenetic protocol with Val. It allowed you to find feelings of abandonment, and you discovered that they weren't hers. They were inherited from her lineage, from a maternal grandmother, I believe. And you said that whenever she felt them, you instructed her to ground herself and release them. Can you talk a bit about that protocol? And then, Val, can we talk about how that felt to let that go, given it wasn't yours?
Mhm.
Yeah, generally, when we go to the original event of some shock or trauma or emotion, sometimes we can hone into finding that it could be not hers and that's something that's, we call it psychogenetic, where it came down and was passed down generationally. Because again, cells have imprints, and if mother or father are going through events or emotions while raising a child, that can definitely pass down to that person as well. And as that person feels those emotions and then becomes theirs, we call that psychogenetic principle. And so through different techniques, making sure that you can cut the cords and understand that it's not yours to hold anymore. And there's this stress calming technique meditation that I've learned from the evolutionary quantum healing technique. It starts with a white light from the heart chakra, because it all starts from self-love and then expands outwards. This is like an auric field of protection. And depending on whether it's mother's side or father's side, you cut the cord on left side with the female energy, right side on the male energy. I always tell the patient to imagine connection from heart chakra to the mother or father, and then it can go to specific generations, however many generations. And then also just finding that there is love from heart to heart, from mother to father, and that there is love there. But when you cut the cord and disconnect from the emotion that they were carrying, you always want to send love back to that person and thank them, because without them, you wouldn't be who you are. But you don't have to carry on that specific trauma or that shock or that emotion that they went through. So releasing the cord, cutting the cord, and then grounding the self, and then keep creating self-love from heart chakra and expanding outwards. That's the process.
How did that feel for you, Val? Did it resonate with you?
Yeah, it did. It wouldn't have really occurred to me, because when I think about my mother, there are issues, but I wouldn't say abandonment was one of them. But then when I think about her mother, I could absolutely see how that resonated. She was abandoned by her parents. And what's interesting about this that I only realized later was in my most recent reading with you, Krista, there was a moment where you said, there's a grandmother here with us, and she's my only deceased grandmother. But because we weren't very close, I was like, I don't know. and then we sort of just kind of moved on. But then it came back in this practice where that's what was being indicated, is that I was holding on to something of hers that I needed to just give back to her and not carry. And certainly I see the ways that my mom has that cord to her that's very strong. And then it was given to me. So that really resonated. And then to practice that exact practice of cutting the cord, it really is interesting. It was done so beautifully because of the love and light and sending it and doing it in this loving act. I think I felt safe to do it, because there's this feeling of, I'm going to cut my cord to my mother. Like, that feels really scary. It's my mother. And that's how we end up tied to and carrying things that aren't ours, as we think that our attachment is dependent on carrying these things. So this has just been the theme of my life in this season, is keeping the part of the connection that serves you and giving back everything else. And having a trauma bond is not the same as having a healthy, good bond. So it's actually a practice that I made note that I could definitely use in this time. And there really was this instant relief. Wait, I don't have to carry that. To be able to give it up was such a gift, and something that can be a regular practice, because we have these patterns, and there's a good chance I might get entangled in that again. And it's so simple to take myself through that visualization.
You remind me of a beautiful expression that love doesn't hurt, attachments do. I think about that all the time. Yeah. A big one.
Ooh, that's a good one.
Right?
So we're still, so we still have, so the last one here is the energetic block. So I'm just going to go there. I think that's the one. This is where we start. So it is. Okay. So then how do we fix it? And let's turn it into money, finance, career, job, love, you, the daughter, mom, to dad. So this is more to mom now. Okay? So think about use the daughter to mom. Your small intestine. So in the emotions in small intestine, we have lost, vulnerable, frightfully enjoyed, mental stability, non-thinking, unable, abandoned. Constantly feeling abandoned. Yeah, okay. And then can you just think of the wire because. Yeah. So actually the concept of not being chosen. Say that. I'm chosen.
I'm chosen.
Okay. I'm worthy of being chosen.
I'm worthy of being chosen.
So there's a block there. He has controversial event. You just felt this abandoned feeling. Conception of 10. Conception of 5. Age 5, 4, 3, 2, 3. Concept of your abandoned feeling. By mom, by dad, by mom, by anyone else. Psychogenetic. This is psychogenetic. This is your mom's. How many generations on your mom's side? 1 to 5. 1, 2. Your mom's mom, your mom's dad. So this is actually a generational thing. So she might have gone through something, and she was abandoned by her mom.
Yeah.
So
She was. Yeah, 100%. Yeah.
Okay.
Her dad actually left, and then her mom had like a nervous breakdown and was never the same when my mom was dying. So she had to take over everything and take care of her mom, become the child adult. And for the rest of her mom's life, she was.
So this is your grandmother's, like from your grandmother to your mom, it's all passed down.
That makes so much sense. And with my grandmother, there's abandonment stuff.
Okay, interesting. Yeah, so that is all coming from there.
Yeah.
So how old, when you're 3, was there any other sibling around? Or?
Yes, my brother.
And how old was he?
He was 8.
Okay, so he's older. Okay.
Yeah.
Okay, so we're gonna just imagine your 3-year-old self, but that's when you absorbed it. That's the abandonment feelings you absorbed at age 3.
Wow.
Okay.
Yeah.
Was your grandma still around? Did you have a relationship with her?
No, never really, but she was around a lot.
Okay.
Yeah.
Okay, so we're gonna go to your 3-year-old self, and we're gonna do like the cord clearing, okay, cord cutting, okay?
Yeah.
So go to your 3-year-old self, just think about how you might have felt abandoned by mom, but really it's not yours, it's you absorbed it, okay? So I'm gonna have you hold your small intestine, and then hand on your forehead. And I'll run you through an exercise, if it's we call it psychogenetic, because you picked it up from them. I want you to imagine a ball of white light from your heart chakra, the size of a tennis ball, and it's spinning clockwise. And as you breathe in and out, it's gonna spin hotter, whiter, faster, get denser, and get bigger. And you eventually go outside of your body. So this is your auric field of protection. We always start from the heart chakra because it's self-love, and then it expands outwards, okay? And then female energies on your left, in your upper left-hand corner, I want you to see an image of mom. And what you're gonna see is the ball of white light from her heart chakra expanding outwards too. These are 2 bubbles of white light, but I want you to see your heart chakra connected to hers, okay? There's a lot of love there, you're connected heart to heart. And then because there's 2 generations, I want you to see your mom in your mom's upper left-hand corner, an image of your grandmother, and then they're connected by a white light too. So there's a lot of love there too. So what I want you to do is cut both cords, and then send love and light back to them. Show them the gratitude. Without them going through what they went through, you wouldn't be who you are. So show them the gratitude, but you don't need to be attached to their abandonment feelings. Okay? So send love and light back to them. After you do that, I want you to ground yourself to the core of the earth. And then keep creating white light from your heart chakra expanding outwards. You don't need to carry it there. And letting that go from that 3-year-old self. Big breath. Inhale. So the abandoned feeling is the concept of not being chosen. It's probably because mom wasn't chosen, grandmother wasn't chosen. You need to let go of that concept.
Yeah. A big relief.
Yeah. So anytime there's an abandonment feeling or feeling not chosen, it might not be yours. Just ground yourself. You can cut the cords with mom and ground it.
Yeah.
That makes sense?
Yeah.
So that's something you can do moving forward.
Yeah. Wow. And I'm all saying this for the recordings I remember.
Yeah, it's okay.
It's so wild because Krista during my reading said something about, I feel like there's a grandmother with us.
Oh, wow.
And I was like, I don't know know, because I'm not really that close to my grandma. I'm like, you know, so.
Wow, yeah. Interesting. That's crazy.
Yeah.
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 Okay, good.
Okay.
Okay, come up here. Go back to 3-year-old self. Lean up front again by mom. Good. Turn your head to the left. Good. Head back around my right eye. Good. Do the 2 fingers. And let's give you some fire spray for the small intestine. This is more for the hormones, circulation, blood flow. Good. Do the 2 fingers as well. Perfect. Good. Take your hands off. And then I'm okay being chosen.
I'm okay being chosen.
Good. I'm worthy of being chosen.
I'm worthy of being
Good.
chosen.
I am chosen.
I am chosen.
Good. That's better. Good. Six toes, straight. Eyes closed. Eyes open. Good. 2-point hidden factors, and this would fix. Perfect. Okay. Take that out. Okay. I allow them in? No.
I allow them in. No.
Good. So there it is. Okay, so you cleared that all. That was all metaphysical.
Wow.
Now that you cleared that, you may not. Let's see. Okay, so what's left? I'm up here. Let's see. Strydium. This was candida. Parasites. Mercury. Rice. And cadmium. They all cleared.
Whoa.
So by holding all those emotions and those organs and letting go of the metaphysical, that helps all this stuff too. Your sensitivity to all these things. So that's pretty powerful.
That is powerful.
Yeah. So my mentor always says start with spiritual, emotional, metaphysical, because
Yeah.
energetically they have a hold on you.
Yeah.
So that's affecting maybe your sensitivity to that stuff.
Wow.
Pretty cool.
Yeah, really cool.
Yeah.
Oh my
I
gosh.
didn't expect that all of them to clear.
Dr. Jerry, you gave Val, after all of the testing and releasing, you then gave her a chiropractic adjustment. Why is that important? What does that do?
Yes, I do believe in the power of the nervous system, and I usually do an adjustment afterwards because you want to reset the neurology of the body after it's gone through this physiological release response. So I think that's a good way of harmonizing everything together on the nervous system level.
So it sets it all back
Yeah.
into
It can help a lot with the processing because we have so many different things that we hold in the organs, and that's all corresponded and held together by the nervous system. And so helping the body on a physical level thereafter, I think, is important.
Sure, of course.
I have a question actually about that, because after you did the adjustment, you told me to walk down the hall.
Yeah.
And before you even said it, I was like, oh my gosh, I feel so light. Like my whole body just felt like it was like walking on clouds or something. And then you said, you might feel lighter. I was
Yeah.
like, yeah. And then I didn't even ask you why that was, what happens.
I think it's just doing the chiropractic adjustments. You do get a sense of endorphin release, but also with the techniques, there's blocking techniques that we do at the end, just lock in the work, save the work on the body's biocomputer. And with all the emotional releases and then the physical releases that we get, the walking helps get the torque out of the body. So I always tell patients to walk up and down the hallway and just reorganize the body, restructure it, and get the torque out of the system. And so most people do sense of relief or just like a lightness afterwards.
Val asked a great question at the end of the session. She asked, how do you maintain this work and all the releases that occurred? What would you suggest?
I think knowing that at the session, what we worked on, it's done. We want to try to move forward from it versus keep stepping back into it. I think that's easier said than done sometimes. But I think the most important thing is the action steps. What have you learned from that session, which I think Valerie definitely is really good at and pinpointing. And then what are the action steps to move forward from this and looking at what the next process might be. I think there's always some type of action step that needs to be taken after the awareness, because when we do the emotional technique work, it was getting the body to become aware. Then what's important is what you do with it afterwards, in my opinion.
You also ask the body what food it needs, how much water, how much sleep, how much exercise, and what supplements. And it's very specific what comes back. That's probably part of it as well.
Yeah, those are all things that I've learned from my mentors. How else can we support the body at that moment in time? So hydration is always important. We always tell patients to take at least half your body weight in fluid ounces or 1 liter per 50 pounds of body weight. And then usually red meat actually helps the body process. So it helps with grounding. And then how much sleep the person needs, how much possible exercise, or what type of proteins or what type of specific foods that the person should avoid to help maintain those things. Usually we tell people to avoid the most common inflammatory foods, which are corn, wheat, soy, dairy, and sugar. When the patient follows those things, we tend to find that they have better ways of processing and they get better results that way. So it's just more informative for the patient. And some people want to ask specific questions about the body. What else can I do? Should I do cold plunge or infrared sauna, or can I do this and that? So I usually use the muscle testing as a guide and ask the body what the person needs at that moment in time.
On a personal note, I would love to ask both of you, what are your self-care or spiritual practices? How do you best balance your energy, and what kinds of things knock you out of alignment?
I think just trying to do the best to stay grounded. I do some distress calming meditation as much as I can. Going to the gym is my outlet. I try to work out a couple times a week, just getting movement and releasing. I think for me is just staying connected to my roots, my foundation, my why, and my purpose of why I'm doing what I'm doing. It just grounds me.
Can we ask that? Why do you do what you do? What does it give you?
I think just a sense of helping others and just putting others first as much as I can, making the world a better place, and obviously just helping everyone reach their potential and giving love and support that I feel like I was giving throughout my whole life with family.
Thank you so much for that. Val, what are your self-care or spiritual practices? What do you do to ground yourself and keep in alignment? What knocks you out of alignment?
Yeah, I have several tools and I just attune to what is needed during specific seasons. So one of them is what I mentioned, mindfulness. I teach mindfulness, just the practice of meditation, doing a body scan, allowing feelings to come up and do their dance and then come out. And dance is huge for me. That's like an instant aligner for me.
You teach dance too, right?
Yeah, I teach dance, and the dance that I teach is not inherently, or I guess overtly spiritual. It's like cardio, fun, silly, but we do set intentions and we do yoga at the end, and feels like a shower for my insides. So dancing is huge, and being in a community, being with friends, you learn these things that make your soul happy, and then do as much of that as possible. And I think when I fall out of alignment, it's when I'm giving too much away and when I'm cutting my body off and getting back into my head and not really doing that attuning for what I need. And sometimes it's just going to happen because I have a young child. So there's an element of forgiving myself when that happens. And sometimes I'll like whisper to my soul and my body, I'm coming back for you. Don't worry. But that's just fresh in my mind because my daughter's been on spring break for 2 weeks. So there hasn't been a ton of self-care. But yeah, I would say meditation, dance, being in community, being in nature, going to the ocean as much as possible. Those are my main things.
Beautiful. Thank you so much. Dr. Jerry, tell us why clients usually come to you. What are they looking for?
I think a lot of people come because they've tried other things already. They've done maybe the functional medicine approach. They've done other chiropractic care or acupuncture, all their different alternatives that they're looking for. I think that we have become more of a name because of the Neuro Emotional Technique work, and people come mainly to understand that there are different stress patterns that they're holding on to, or to alleviate their stress, because that is really the silent killer, whether it's conscious or subconscious. I think people want to come in and try something different, and there is more awareness with especially mental health and emotional trauma. People are recognizing that we don't need to hold on to these things, and they do create disease and illness in our body. Our practice is identifying those things and helping people process, and I think that's a beautiful thing.
Yeah. And I know that you are always going to conferences and continuing your education and learning. Do you see it growing? Are there more modalities showing up on the planet that you're interested in?
Yeah, definitely. There's a lot of different techniques that are spinning off. A lot of them are also like more nutritional techniques, but there are also a lot of techniques that are working in the quantum space for healing, using more energy, vibration, frequency. I heard this term frequency medicine, that's the buzzword. I think a lot of that stems from the roots of kinesiology with muscle testing and biofeedback And I think that's the future of medicine, it seems like.
Yeah. It's got to be exciting to be a part of that, huh?
Yeah, absolutely. Yeah.
How many sessions do you usually recommend for people, or does it depend upon what they're working through?
Yeah, I think it just depends. I don't really do certain plans or anything. I just see the person as they are. And most people come back in a month. If I feel like there's a specific thing that I need to hone in on, then I'll have them come back in a couple of weeks. But I do try to honor the body and allow the person to process after the work. I usually ask the body the best time they should come back. Sometimes the rational brain says, no, I think that's too late or it's too soon. And I'll say, okay, let's have you do like something in the middle. So I try to honor the body. If they don't feel changes within 3 or 4 sessions, I tell people, maybe we can look into other options or try something different. A lot of the clients like to come in once a month, kind of maintenance, wellness type of routines for the emotional hygiene, to know that something that they're working on a regular basis, trying to get to that pillar of health instead of doing it one time and then just moving on to something else.
It is that onion concept too. There's just layers upon layers upon layers upon layers, depending on the person, of course. Yeah. It's interesting because you do ask the body. You ask the body when it wants to come back or when it needs to come back. So
yeah, definitely.
Yeah. All right, guys, this was amazing. Thank you so much. I'd love to let people know where to find you. Dr. Jerry, you're at kenhealthwellness.com, correct?
Yeah. We're in South Pasadena, California. And you can find NET practitioners pretty much globally, netmindbody.com. If you're looking for applied kinesiology, more functional approach, or physiological approach, ICAKUSA.com, International College of Applied Kinesiology. So there's doctors that do a lot of this work.
Beautiful.
Yeah.
We'll put all that information on the website too. Val, where can people find you and your mindfulness classes and your dance classes?
Yeah, I post a lot about that on my Instagram, which is Valerie and Cheney. I also have a podcast with my husband. It's his podcast. It's called You Made It Weird. And on Wednesdays, he does just him and a guest. He's a comedian. But then on Fridays, it's just he and I, and we discuss all this stuff and more. So, yeah.
Awesome. Thank you so much. We'll put that on the website as well.
Mm-hmm.
Is there anything that you guys wanted to talk about that we didn't cover? Anything feel incomplete?
I want to thank you for the opportunity, Krista, to have this and share this platform with you. And
Thank you.
Thank you so much.
Yeah, thank you both so much.
thank you, Valerie, for opening up and allowing the processing to happen. And it's great. It was great. It's very beautiful.
Thank you. Thank you for making me feel safe to do so.
Thank you both so much for your time and your energy. I'm truly honored to have you both here. Thank you.
Thank you.
Thank you so much.
Thank you.
Right. Thank you.
Thank you.
Everyone.
Thank you for joining us for this episode of The Beginner's Guide to the Third Eye. For more information about the show, visit our website, beginnersguidetothethirdeye.com. For show inquiries, email us at guidetothethirdeye@gmail.com. And visit the shop page on our website to find many of the products suggested by our practitioners and participants. And if you would be so kind, please leave a review and follow us on your go-to podcast platform, as it helps build our audience. Thank you. See you soon.